All right. As always, for anyone with chronic persistent head, neck, and jaw pain, we actually have a really good talk for you today. We're going to be doing a live with Dr. Clayton. So he is a dentist here, and we are going to talk all things airway, teeth, mouth, pain, cavities, all of it, occlusion. And I'm inviting him right now to join me on the live. So he's going to bring a whole new perspective to what we already talk about on the channel. And we're waiting on Instagram, but we're going to give a much more all-inclusive look at everything. All right, there he is. How you doing?
Great. It's wonderful to join you today. Thank you so much for the invitation.
Oh, thank you. Yeah, you have a much needed perspective, I think, for everyone who watches these lives, and I think it's going to be great. So, just a little bit about you. Where do you practice, and just what do you do?
I am in Meridian, Idaho, and I've been practicing here for 5 years, and I've had my practice for 3 years. This month actually is our anniversary.
Oh, nice.
And I started when I started dental school. I didn't have a good enough idea of what I was getting into. And about halfway through second year, I'm like, I think I want out of this. This just seems like I'm becoming more of a tooth technician than an oral health specialist. No, we were going through all the good classes, but there just wasn't enough emphasis on actually curing disease, especially with modern sophisticated treatments.
Right.
And
So,
it took a while to figure out where to go.
So when you talk about modern disease and even more so your goals of treatment, what are you spending your time treating and focusing on?
The main things I'm focusing on are first restorative dentistry, so fixing teeth in a way that is as natural as possible and really respecting the biology and mechanical functions of the tooth, how the tooth flexes and moves. The other is treating oral inflammation, particularly gum tissue, which is driven by bacteria and made worse by breathing through the mouth. And so getting patients healthier using saliva testing to figure out what those pathogens or bad bacteria are, what viruses or yeast are present, and then addressing those in a very gentle way, because we want to support the body in healing itself rather than trying to bombard it with something that beats the biofilm or the bacteria into submission, which we know doesn't work long term. And then airway health is our other pillar or our third main pillar, because it involves the airway, the mouth, and it's something that falls into our expertise. And we have a different, in functional dentistry, holistic dentistry, we have a different perspective than a lot of physicians or ENTs in general. So that's something that's been unique to dentistry, even to those that aren't in the holistic space. There's just a lot more awareness. And then we'll treat, bite. So people that have, and we don't do that as much. So I'd say that's not really in the third pillar, but it's still in my expertise of what I look for, evaluate, and figure out how to resolve bite issues, because that can lead to chronic pain and difficulty eating, which is not good.
No. And I think most of the people watching can relate to that, unfortunately.
Yeah.
So it kind of reminds me of my world, which is if you have pain in a certain area, you're not going to just go to that area and say, like, let's get that muscle to relax, or let's just only remove inflammation from that one area, or just get it moving better. You can do that. And there is a time and a place for that, for people to say, I have relief. But you stop it from coming back by looking at the system. And from what I'm understanding from what you're saying, it's like if there's a tooth issue, it's a recurring tooth issue or a recurring problem someone comes in for, you don't just go to that piece of skin or that piece of gum or that tooth and say, like, here, we're going to patch it up and you're good. You're looking at the entire oral cavity, basically,
Exactly.
and beyond that,
Yes.
systemically.
Yeah. No, I'll give you an example of that. So it's just not something I see as common. But when I do see it, I have a series of questions that I ask. A big one is if the patient has had orthodontic treatment, because if that bite isn't idealized after orthodontic treatment, then that starts to cause some major issues. And I found that so many of my patients that are experiencing these jaw pains, muscle aches, and issues, I'll track it down to that. Like, when did it start? Oh, after I had ortho treatment. But
Mm-hmm.
one patient, it just came out of the blue, and she had severe pain, limited opening, difficulty chewing, was evaluated and said, well, these teeth, I think, died in that upper left. And so you either need root canal therapy, you have to get them taken out. Fortunately, she didn't feel good about that. And I found her and figured out it was a bite issue and went through my protocol. And within a couple of weeks, the pain was gone. She could chew again. She was able to open her mouth longer or wider. And then I took her through my protocol of adjusting the teeth, getting the bite correct again. And she's been fine ever since.
So, so people who are coming in to see you, it's your typical reasons that you would go see the dentist. My tooth hurts. I need a cleaning. I mean, those are two of the big ones, right? I have pain, or
Yeah.
it's time for me. And then you're just approaching it in a different way. So it's like these people would be, because I guess what I'm getting at is, if people had these types of issues that you're addressing, what would they be experiencing? Maybe that's a better question.
So what would they be experiencing as far as like treatment
Like,
recommendations from like traditional dentistry?
yeah, I guess using a holistic and a functional approach, I guess the way to phrase the question would be, what would people be feeling, or what would they have been experiencing that would make them a candidate for this? I mean, maybe you would say everybody, but like,
Yeah.
you see what I'm saying, where
Yeah.
I'm going with it? Like, how can this help people, and like, what problems does it solve?
Yeah. I really, really everyone,
Okay, yeah,
dentistry
it's
has
just
been
the way
so
to approach it.
exactly because dentistry has been so focused on treating symptoms,
Yeah.
filling teeth, doing crowns, taking out teeth, doing full mouth rehabilitation, which means, putting crowns or veneers on all the teeth. They're taking the teeth out and putting prosthetics in that are fixed into the jawbones. And there hasn't been enough emphasis on figuring out, why is this happening?
Okay.
So we've really missed the mark that way, or doing aggressive surgery to treat gum disease instead of really figuring out, okay, what's going on? What are the risk factors? Because if we don't address those, like if they get their teeth pulled out and get implants in and, a new set of prosthetic teeth, implants can still get gum disease. So if we haven't
Really?
figured out what's causing this gum disease that's contributing to losing all their teeth, then we could have the same issue with those implants, and those could
Right.
start failing because it's a bacterial issue that hasn't been resolved.
Wow, that makes a lot of sense. I can't believe that's been overlooked. It's just a lot harder to do that than
Yeah,
just getting in there and just addressing symptoms.
and unfortunately, it's just not. I mean, frankly, it's not popular, right?
It almost
Because
goes against the business model.
exactly, and
You're right.
insurance doesn't. They're not going to pay for saliva testing. They're not going to pay for hour and a half long diagnostic exams.
Hmm.
They're going to pay for taking teeth out and fixing teeth, and so that just incentivizes this
Yeah.
this perpetuation of just addressing the symptom. So in the CE lecture circuit, it's all about how to do implants and how to do
Hmm.
clicker dentistry and how to increase your production and decrease how much time your patients spend in hygiene getting their cleanings, instead of implementing, like, well, actually, if we pay for saliva testing and better diagnostic work, we can actually save money in the long term because we're avoiding more expensive, more invasive treatments. So same thing, if insurance or just the general, just dentistry in general, focused on prevention, then we're avoiding these really costly invasive treatments, which isn't ideal for a business model.
Right.
And I don't want to I want to respect my colleagues, and they're
Of
operating
course.
with the information they have,
Yeah.
but that's the problem. Insurance is
Yeah.
incentivizing it. The CE lectures are incentivizing it and teaching it that way. Dental schools are doing the same thing. So if all if all you have is a hammer, everything
Yeah.
is a nail.
Yeah. I love that.
That's the biggest problem. And I imagine you've probably, or you may have seen that in your career.
Yeah. Yeah. No, absolutely. It's, sometimes treatments, it's prioritizing the short and the long term. And I think you can achieve, I mean, I know you can achieve both, but
Yeah.
it, the way that you look at the interaction with the patient and the way that you go about your evaluation is going to determine how their outcome, and meaning like when they feel the benefits, how long those benefits last, etc. Like, to give you an example, like I had someone recently who was actually upset with me because, and maybe this is on me for not explaining my process. I do think that I talk and post enough, but
Yeah.
this is on me. But their sentiment after was that after this whole evaluation, like, there should have been massage, and there should have been stretching, and there should have been like a significant improvement, and there should have been exercises that no one has ever heard of, these different exercises. I should have been doing all these imaging and x-rays, and I was trying to explain that, like, in an ideal world, in one block of time that I can work with you, it would be great to get you that short-term result that you're discussing and be able to also set you up for the long term. And I always go for that. But sometimes when things get complicated and we're getting into it, if I start shifting towards that short term so that they're happy when they leave in that next hour, then I'm directly taking away from that long term. I'm immediately removing. So the way that you frame your mind as a practitioner going in is exactly, it immediately dictates what they get coming out. And that's why you have to align with your patients first. Like, listen, this is the way that I do it, and I need to make sure that you're willing to do this, because typically if you want that long-term result, like, we're going to have a little bit of a longer relationship, and not everything is 100%. Like, I'll tell you right now, like, in this moment I think this is the best thing for you, but it might not be. And the only way to know that is for us to test this little hypothesis that we came up with, and then we have to do it again and again. And that's why I think, like, and I'm sure that's why you're active on social media as well. It takes a long time to be able to educate someone on all the pieces that it takes. But once it starts clicking for you, the outcomes are that much more significant.
Yeah. I couldn't agree more. So sometimes we have to pivot. And as well, dentistry is just pretty behind. So we continue to have emerging evidence, and then having to shift how we do things, change our testing, change our protocols. And it's not something overnight. And that's something that people want, is just a quick fix. Like, what product do I start using so I stop getting cavities? And it's just like, that's why we wrote a 160 plus page guide to help you identify your risk factors and move through this, because it isn't as simple as it's not a quick fix. It's not just changing your products and boom, you've solved your problem.
Right. That's great, having that education. So when it comes to, let's kind of, because I know we can talk about a million different things, and some will be, there will be overlap between us and there won't be.
Yeah.
But when we're talking about people who are having just this, like, maybe just ongoing jaw discomfort, or, just that feeling of tension, let's say, and we start looking, and it's not a specific tooth issue, but maybe it has more to do with the airway and the mouth and the structure. Like, has there been what are the things that you look for that would determine, like, a non-functional airway, or an airway that is having issues, or that people watching should understand that, like, could be contributing to what they're experiencing?
So I look at sleepiness. That's one of the evaluations. Is just is using something called, and there's a lot of different assessments, but using the Epworth Sleepiness Scale, and that's just, it's investigating and seeing, is the patient, do they fall asleep easily when they're sitting on the couch? Do they get drowsy driving? Do they wake up and consistently feel like they're not rested in the morning, no matter how much sleep they get. So those are some questions I ask, but then I also look at their bite. How did their teeth relate to each other, and how narrow are their jaws? Is their lower jaw recessed? Are both jaws recessed? Is their tongue too large, relative to the jaw width? Is the soft palate, that tissue that extends towards the back of the throat from the upper jaw and has the uvula, that little tissue that's hanging down in the middle, is that really long? Is their nasal passage narrow, or do they have a severe deviated septum, or do they have tonsil inflammation, adenoids? So I'm looking at a bunch of different factors. So a lot of anatomical factors, and then habits. Is their tongue resting low? Do they sleep on their back every night? Do they have a difficult time swallowing correctly? Those are all different things, but really starting with symptoms.
Yeah.
And it's interesting because a lot of patients compensate pretty well, and they may feel like, I get okay sleep.
Yeah.
But then I look at the factors, and they're snoring every night. I'm like, I bet if we treat it, you'd realize, I was not getting quality sleep. This has just been my set baseline for the last decade.
Yeah.
So I see things I'm looking for.
Yeah, and I also look, and when you see that, sometimes you can't even see the airway. You just see soft palate and tongue, and like you can see no uvula, nothing in between. You see that redness, you see that scalloping or biting on the tongue.
Yes.
You see the cheek walls bit, and for me, yes, it's no matter how much sleep I get, I'm still tired for the most part, but it's also the people who clench at nighttime. I always see a relationship there for the most part. Headachy, when it comes to pain, pillow position and clenching can also contribute. So there's still a musculoskeletal piece to it. But usually, if they're not able to oxygenate throughout the night, there's this achiness no matter what. And it's not like, I have this one spasm right here. It's everything's achy, everything's sore. There's clenching, there's lack of oxygenation, and I always recommend people who just, even if they check a couple of the boxes, just look into a sleep study and just have more information. Then you can work, and then there's different measures you can take from there. But if I find that usually there's a trickle down effect. So the airway, the clenching is causing now inflammation or synovitis right in the TMJ. So they're just click, clench, 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 and it's just producing pain here. Even if there's not at that time a true joint issue happening in there, over time synovitis can degrade the joint, and that can happen from the clenching and from the tension, which is usually tied to airway limitations. And so one thing we can get into, I guess, in a moment, like sometimes having a night appliance just specifically for the spacing of the TMJ, it doesn't stop them from clenching, but just being able to decompress if their main driver is a TMJ issue is one thing that I find helpful. But I usually tell people, during the day, we need to make sure that you're actually using your airway in the best way possible. Like, are you fully collapsed too far one way or the other way, limiting? Are there certain muscles holding you in the wrong position? Do you need to clear your sinuses? Like, will simple saline spray create some clearance in there and allow you to start breathing better? What can we, outside of like a pure structural issue that I have no ability to impact, what can we do? And we can usually chip away and get a 10%, 25, 50%. Like, we can get functional improvements just from implementing these strategies. And actually part of nasal breathing is just using it like a muscle as well. Like, just actually allowing your sinuses and your nasal cavity to allow for the air to come through.
Yes. I want to add one thing before I answer that question.
Yeah.
That's a terrific question. I've got my little skull here as well. Let me
Nice.
this lower jaw. But something that I see a lot is patients that are diagnosed with grinding that aren't grinding in the true sense. One of the estimated number of people that actually fit the diagnosis of nocturnal bruxism, which is controlled by the brain. It can be stress, can be a myriad of things, is only about 10%. The rest have either habits that are wearing down the teeth during the day or other things. But one thing I see a lot is worn teeth. So these front teeth will be worn flat. And so it looks like grinding patterns. But if I have them grind to side, they don't line up very well, and there's not wear on the back teeth. But if someone has an airway issue, they're sliding their lower jaw forward all night long, because when they slide their jaw forward, it pulls the tongue away and out of the airway, and then they can breathe better. And so that's something I'm looking for too, is that tooth wear pattern.
Would you recommend some type of like protection on the teeth in those individuals?
Yes. Yeah. Depending on severity. So treating it, things that we can do to treat some of the soft tissue issues and inflammation that's decreasing airway sizes, as you mentioned, saline sprays. I love a spray called Clear. It's XLEAR.
Okay, yeah. Yep.
Yeah.
That
Yeah.
And that has in the like a grapefruit. Is it a grapefruit extract?
Grapefruit seed extract.
Yeah.
And xylitol. One reason I like it is I'm big on evidence-based products, and they've done testing. And so that helps to establish a healthier microbiome, not only in the nose, but also in the throat and lungs, which is really neat. And the xylitol feeds the good bacteria. The grapefruit seed extract is a very gentle anti-inflammatory and targets those bad bacteria.
Okay.
That's a great thing to do, because that can open up the nasal passages. It can reduce inflammation in the back of the nasal passage.
I just have a quick question on that. Is that something that you recommend people to do indefinitely or for a bout of time?
It's safe to use indefinitely because it is a natural product, and it's shown to be helpful to the bacteria and gentle. That's something I recommend patients do every night. It just helps, especially with the increase in allergens from decreased air quality, allergens inside our house, whether that's ventilation or dust from carpets. Or houses are becoming increasingly airtight, which means the air is becoming stagnant. So opening the windows during the day when the air quality is good outside. So it is a safe product to use, and it's not like other nasal sprays that you buy from the pharmacy. So it is safe, gentle to use every night, as much as you want throughout the day.
Got you. Was there something else that you were gonna?
Yes.
Okay. Yeah. Go for it.
Yeah. Tongue posture is a huge one, because the tongue is a massive muscle. It's 8 pairs of muscles that control all the different positions of the tongue. And one of the muscles that attaches down at the hyoid, which is that bone right above that cartilage in the neck where the thyroid is. There's a little bone right above it. And there's one large muscle in particular that attaches to it. And when it's activated, it activates the vagus nerve. And 2, it pulls the tongue up and forward, which opens up the airway. So addressing the poor tongue posture and increasing the strength opens up the airway. And a treatment called orofacial myofunctional therapy is very effective for retraining those airway muscles, because the same 23 muscles that we use to eat, speak, and chew are the same ones that hold the airway open. And so I describe that treatment as like physical therapy.
That was a good term. Physical therapy.
Yeah, exactly. Physical therapy for the airway muscles. Is it's retraining them, rehabilitating them. But in more severe cases where the tongue is too large, the jaws are too small, the airway is really small, like even if we train those muscles, we're not going to get is the improvement that we need just because the anatomy is way too constricted.
Yeah,
And
and
so
then
then an appliance works great for that.
Yeah.
And so then we're more limited, but an easy or accessible way to treating that is an appliance to wear at night that holds the lower jaw forward. But then that can affect jaw joint health. And
yeah.
so
I think it's a good,
challenging
no, yeah, and listen,
at
it needs to be
times.
said, right? I mean,
Yeah.
sometimes there's other factors at play, and so that's just one of them. And then if it becomes, if you get to that point where it's again, sticking with the word functional, if it's functionally impacting your day to day and there's nothing else you can do about it, then use the device. With those devices, with TMJ disorder, if you have, when people talk about TMJ is just a term that gets thrown around, like, oh, I have TMJ, I have
Yeah.
TMJ,
Yeah.
which is funny because it's just a joint. So it's like saying I have shoulder, I have knee. But
Yeah. Yeah. I love
but
that. My professors used to say that.
yeah.
So think of that.
But I usually tell people, think of it as jaw pain, right? I have pain here. All right, now what's causing it? Is it a clenching parafunction? Is it muscle tension? That's one type of jaw pain. Is it referred
Yes.
from another part of the body? Some of the muscles of the upper neck, lower neck, other areas. Okay, that's a type of pain you have on your jaw. Is it actually, like we said, referred from other muscles? Is it now a joint issue? Now this is different. Now this is
Yes.
a whole different situation.
Yes.
Is it just an inflammation or an irritation? And then is there a disc out of position? That's clicking, popping, or in severe cases you can't open all the way or you shift. In those cases, when there's a significant disc displacement or a complete restriction, I always like to tell people with any type of device that anteriorly repositions you have to just be careful, because now you're on top of a already dysfunctional disc and you're shifting forward. And some people may get away with a fine, but there is a contraindication for that. And again, that's the point of having good providers, just being able to lay that out for you. When it
And,
comes,
and that's
sorry,
something really, yeah, that is, I agree with you 100%. I just want to say as a oral health professional, I'm very collaborative in my approach. And that's something really important to take into account, those risk factors. And then I like to refer those patients to physical therapists and chiropractors, other professionals first, to help to address that root, that jaw joint issues. But, whether it's a muscular or referred pain, but especially when it's that has to do with the actual joint and the cartilage disc, I like to refer them elsewhere to see if we can resolve that, or especially before any sort of anterior device.
Gotcha. Yeah, I think it's so important. That's great to hear. So we have about like 7 more minutes, and that's on me because I was running late today. But just in terms of oral health and body balance, so what I'm feel like you're getting at is that like the pH and the balance of your body and acid and all that, it can be the thing that's wearing down your teeth as well, at least one factor. What other things, if it's just not a power function, which for anyone watching, power function is really just any activity with your teeth beside that's not a normal activity that can produce issues. Actually, I'm not even sure if it means it could produce issue or not. It's just saying I
Yeah.
bite my nails, I hit my teeth together. It's not a functional, again, productive
Yeah.
behavior.
Yeah.
Besides for some of those behaviors, what other things could be wearing down your teeth that people should be aware of, or just oral health issues that people may not be aware of?
Yeah. So as far as wearing down the teeth, if it's not a parafunctional habit, and some of the most common are cheek biting, lip biting, and nail biting, then another big one is looking at the bite, because if when the teeth, the the jaw joint should be, as you know, in the most stable position is up and forward, really locked into that joint. But when their teeth come together and it puts their joint in a position other than that, then it can cause premature wear, because as they're functioning, as they're chewing, we have this fight of the teeth are forcing the jaw joint this way, but the jaw joint actually wants to sit in this other location. So until that equalizes, we can continue to get this wear, because teeth aren't supposed to wear down more than in a healthy, stable system, more than 1 millimeter per 100 years.
Wow.
And it's uncommon, But I see patients that have no parafunctional habits and have a just perfectly balanced system that have no tooth wear, that are adults, 30, 40, 50 years old. But patients that are snoring, that have parafunctional habits, that have incorrect bites, all of those are going to cause a lot of tooth wear. And then the other really big, well, there's so much. This time has gone by so fast. But the other big thing is in dentistry, there's this habit of like it doesn't, or there's this mindset where if I'm not experiencing pain, there's not an issue. But the problem is a lot of gum inflammation, it's not painful until it's severe. But if there's any amount of bleeding at any point in time, flossing, brushing, that is a major red flag that something's wrong. When there's bleeding anywhere in the gum tissue, that's an open door for bacteria and viruses to get in the bloodstream. And we find these bacteria linked to more than 57 systemic diseases. And for example, up to 50% of heart attacks and cardiovascular events, like heart attack, strokes, are now the hypothesis or the theory that's pretty well established is that they're caused by oral bacteria. Hence why heart surgeons won't operate on patients until these patients have been cleared by a dentist. And so any amount of bleeding, it's like if you were to push, this is the example I use all the time. If you were to push on your fingernail and you started bleeding spontaneously underneath it, you go to the doctor or the ER, like, what's going on? But then if we floss and we bleed, they're like, yeah, that's normal. But that means, it means that open door is there. And then for teeth, the teeth won't hurt until, if it's from a cavity, the teeth won't hurt until that decay is really deep. At the point where a big filling or an onlay, more invasive treatment, or worst case scenario, the tooth can be lost, the nerve can die. So those are two things. Like,
I know I've heard that
pain, things are wrong.
Yeah, I've heard that if your immune system is in like a state that's down, you're going to bleed a little more. Is there truth to that, or is that
there is some truth to that? Because some autoimmune diseases and then imbalance of hormones like estrogen dominance makes the gum tissue more reactive to bacteria in the mouth and other, and can be compounds in food or allergens. So
I wonder, because I've noticed personally, like once in a blue moon I'll floss and then I just got like 3 different teeth bleeding. So I'm like, was my body in a different state at that point in time? Like, was I just coming off sickness? And then it's not a recurring, it'll happen, like I said, once in a blue moon. So, why were my gums more sensitive that particular time?
It's
sure
sometimes
so many factors.
Yeah, it can be hard to nail down, especially because the microbiome can be different on one side of the mouth compared to the other. For example, we can have a microbiome on one side causing inflammation of the gums, and then a disease-causing microbiome on the other side is causing cavities. But it's hard to nail down sometimes, especially when it's inflammation that affects a couple teeth for a shorter period of time.
So many factors.
So many factors, and I wanted to get into the microbiome of the mouth.
Let's do it. I still have some time.
Okay. So the microbiome of the mouth is very it's very sensitive. A lot of tissue in our mouth has very few, it is a very, very thin layer, a very thin barrier between the mouth and the rest of the body. Hence why there are plenty of medications that are placed below the tongue because they absorb well through a very thin tissue. So in our community, there's a lot of homemade oral care products, whether that's rinses or toothpaste. And I always caution people, just because they're made with natural materials doesn't mean that they're safe.
Mm-hmm.
I have patients that have used essential oils that makes their inflammation worse in their mouth, that increases the risk of cavities. Using baking soda rinses, the salt in the baking soda competes with calcium for the tooth surface, so it disrupts that natural mineralization process and can
Oh,
actually
wow.
make the teeth more at risk of cavities. And that's the chemistry showing that. So sometimes we put too much emphasis on the biology of like, well, we have studies that show that essential oils reduce bad bacteria. It's like, yeah, but those are studied in the lab with very specific amounts. It disregards chemistry of the oral microbiome. And then the product market is unregulated. So if you're making your own product or buying a product that's not tested, which most of them are not, you have no idea. It's a Goldilocks situation. Like,
Yeah.
an essential oil could be in such a low amount that it does nothing. It
Yep.
could be in a high amount and it's actually killing human cells.
Wow.
Or it could be just perfect. But if they've never done testing on it, there's no way to establish that. And the more ingredients we add to the mouth, the more it competes with the natural system. Because the best system to maintain the health of our mouth is the saliva. So disrupting it, encouraging more saliva flow, making sure we have a balanced diet so the saliva has the proteins and the minerals that our mouth needs to maintain balance is so important. So it's something that really bothers me in this community, is this, like, make this product, and these people pushing these products or recipes that are harmful, that don't work, especially when they're being pushed by people that they're not oral health professionals,
Yeah.
or they ignore the fact that there's not research, or that the research that's been done shows that it's harmful and not helpful. So I like to put that out there. So all of you that are watching this, either now or later, please do not do that. The only product that I recommend is called Elementa, and it's because it's tried and tested. It's tested to be non-toxic. It's simple. It's designed to help the microbiome. It only has a couple ingredients, and they're not in a concentration that's going to negatively impact the microbiome. But at this point, there's nothing else on the market that's actually tested and proven to work not only in a laboratory setting, but also in the mouth, to work effectively and respect the physiology, the chemistry, and the biology that's all necessary to maintain the health of the mouth.
Wow, it's amazing.
There's my rant.
No, I love
But
it.
it's so crucial, because
Yeah, I
everybody's
can
focused
imagine.
on this quick fix of like, tell me what product I need to do. So when they see an influencer that's 2 million followers and they say, make this recipe at home, they're like, great, I trust that person because they seem
Right.
like a professional. But it's like, that
Yeah.
can actually make your problem worse.
Yeah, I think I fully agree. And I think that people are smartening up a little bit more now. I think that like 5 years ago, anything, people would be like, "Yes, I'm in." And I think it's starting. Social media hit us in the face so fast. So I think that people are starting to smarten up and like trying to look into people's credentials and etc.
I sure hope
And
so.
I'm sure we could do a whole nother talk, and we should. I would love to really dive into oral health and talk about everything from like diet to inflammation levels to acid reflux and like, because I can only imagine like the impact on the mouth and the teeth and the enamel and everything. And that seems like another huge piece that people probably just don't know where to start. So,
Yeah,
um,
that's
what
true.
let's do a part two to this because I think it's usually good to start like how we did. We hit a bunch of things that address people's needs for both of our communities, and maybe we can get a little bit more niche on another talk.
That'd be great. I would
Yeah.
absolutely love that.
Okay.
This,
All right. Let's do that.
I feel like dentistry is pretty slow to change.
Yeah.
So I would love to get this information out there.
All right. That sounds good. So we'll do that. Thanks for joining me. I really appreciate it. Looking forward to the next time. And yeah, I guess that's it. We'll wrap it up.
All right. It's been an absolute blast. Thank you so much for the invitation.
All right. Thank you. You have a good one.
All right. You too.
All right. Bye bye.
Bye.